right to use human euthanasia when facing a terminal illness is a basic human right that should be decided between the patient and their doctor. Over the past century, the topic of human euthanasia has become a heavily debated subject in countries across the world. Doctors and citizens alike have argued for the benefits and the drawbacks of participating in doctor-assisted suicide. And there are two different types of doctor-assisted suicide. The first is voluntary euthanasia. According to the Washington University School of Medicine, voluntary euthanasia is when a physician provides a competent terminally ill patient with a prescription for a lethal dose of medication upon the patient's request, which the patient tends to use to end his or her own life. The second type of human euthanasia is non-voluntary euthanasia, also known as a mercy killing. According to procon.org, non-voluntary euthanasia is performed when the consent of the patient is unable to be given, usually because they are in a persistent vegetative state. Over the past century, human euthanasia has become legal in several countries and states within the United States. According to Stanford.com, it became legal in Australia in 1990, the Netherlands in 2000, Belgium in 2002, Oregon in 1994, Washington in 2008, Vermont in 2013, and according to MSNBC, Montana legalized human euthanasia in 2009. And now that you understand human euthanasia and its history, we can discuss the requirements that doctors look to before deciding to participate in euthanasia. Although human euthanasia has been in practice for centuries, doctors now follow a strict set of requirements for their patients before agreeing to participate in doctor-assisted suicide. According to Stanford, these include that they must be suffering from a terminal illness. This is the most restrictive of the 5 guidelines. Not anybody can participate in human euthanasia. This usually limits victims of early-stage Alzheimer's or victims of accidents that have now become quadriplegics. The second requirement is that they are unlikely to or will not benefit from the discovery of a cure for their illness during the remaining of their life. This means it is unlikely that a cure will be discovered anytime soon, and that there is no available medicine that will be able to save them or turn their disease around. The third is that they must be suffering from terrible pain or an otherwise unacceptable quality of life. In a study provided by the Netherlands, victims that decided to pursue human euthanasia decided that pain is not the thing that they most often want to escape. Most often it is the frustration of losing their independence and becoming a burden to their families. They are living such an awful life that they would rather die. The fourth requirement is that they have an enduring, voluntary, and competent will to die. The patient has to be sane and to make the request several times before their doctors will begin to consider it. And the fifth is that they must be unable to commit suicide without assistance. This is the second most restrictive of all of the guidelines, as most terminally ill patients are able to take their own lives. Now, most people look to the Hippocratic Oath to argue against human euthanasia, but parts of the Hippocratic Oath have been changed to reflect changes in modern medicine. The first being that women were not originally allowed to practice medicine according to the Hippocratic Oath. The second being that the Hippocratic Oath stated that no doctor should break open the skin or touch blood. If we followed this today, it would be impossible to practice modern medicine. Most people look to the do not harm part of the Hippocratic Oath, but isn't letting someone live a terrible quality of life and suffer a painful death from their terminal disease allowing them to be harmed? Because we've looked at the requirements for human euthanasia, we can look at the people who have been helped through human euthanasia. There have been multiple people living with terminal and terrible diseases that have chosen to use human euthanasia rather than suffer a pain and slothful death. The most famous of all these is most likely Brittany Maynard. By now, I'm sure that most of you have heard of Brittany Maynard, the Oregon native who decided at the age of 29 that she was going to end her own life. But Brittany was not struggling with depression or feeling suicidal. Rather, she'd been diagnosed with stage 4 brain cancer and had been given only a few months to live. Instead of dying a slow and painful death, Brittany decided to take matters into her own hands and take her life through doctor-assisted suicide, also known as voluntary euthanasia. According to CNN, she had been diagnosed with stage 4 brain cancer in the spring of 2014. Her doctors told her that she would experience seizures, loss of motor capabilities, and personality changes. She was told that there was no cure and instead decided that she wanted to die with dignity. She chose to participate in voluntary euthanasia and died on November 2nd. The second case of human euthanasia is an infant named Sun Hudson. Sun Hudson was born on September 25, 2004. Shortly after his birth, he was diagnosed with thanatophoric dysplasia, which is extremely short limbs, a narrow chest and rib cage, underdeveloped lungs, and a large head. It is almost always fatal. Patients that are diagnosed with thanatophoric dysplasia are usually stillborns or die shortly after birth. His doctors decided that it would be best to take him off of life support because his quality of life would be terrible and he was not going to survive. Most people would argue that he was just a baby. How would his doctors be able to know what his quality of life would have been? Well, the oldest living person with thanatophoric dysplasia is a 29-year-old female. She is fully dependent on a ventilator. She has to be fed using purees and a feeding tube. She has to use a catheter regularly and is prone to bladder infections. She is significantly impaired with her hearing, and she suffered cardiac arrest at the age of 24. The end.